Hey everyone, my name is Jodi Wolf. I am a member of Cure CMD's Board of Directors. I am thrilled today to welcome you to a presentation, a panel on the transition to adulthood for healthcare in congenital muscular dystrophy. I am thrilled to have a great panel of young people to talk to you today, to tell you about their experiences in the transition to adulthood, specifically about healthcare. Well, I'm just going to start by introducing our topic today, and then we'll get to our panelists. There are many aspects to the transition to adulthood for youth with rare diseases and disability. There's education, independent living, relationships, and today we're going to focus on healthcare. When this happens well, the transition to adulthood with healthcare, it's a process and not just an event. And it happens over the course of several years. You know, when it happens well, young people can feel empowered to take more of a leadership role and control of their care and their health. It's a thoughtful and coordinated process. But when this doesn't go well, at worst, it's a disruption of care that can result in life-threatening situations. A lot of work has been done by professional bodies to establish best practices in healthcare transition from pediatric to adult care. Federal funding has been used to establish the Got Transition website, which I encourage you all to check out. But the transition in healthcare is not just about the providers. It's even more complicated because young people are handling the transition and benefits as well. So insurance, Social Security, Medicaid, things like this. So how the transition to adulthood takes place in neuromuscular disease care. Some physicians are adult providers only. Some are pediatric providers only. Some are adult providers who see kids, and others are pediatric physicians, neurologists who see young people throughout their lifespan. It happens different in every single neuromuscular clinic. And this can be different across different specialists. You may have one specialist that needs to transition you to an adult provider, while you may be able to keep other specialists who can see you there throughout your lifetime. Often, the transition to adulthood can be dictated by the comfort level of the physician in seeing adults, but then also hospital policies. So if you're seen at a children's hospital, they may have specific policies that say they can only see you until you're 19, 21, and this varies across clinics. Some neuromuscular disease clinics have policies and procedures to transition patients from pediatric to adult care, but realistically, many do not. And sometimes it's hard to find adult providers to transition young people with muscular dystrophy to. You know, in general, I think in congenital muscular dystrophy, we deal with a lack of good CMD adult care. You know, some of the even the neuromuscular muscular dystrophy specialty clinics might see one or two people with your type of CMD. So being an advocate for yourself is very important during this period of time. I'm going to move away from my introduction. I'm going to let you hear from the young people themselves and from our panel. And because this happens differently everywhere, maybe we'll start with the older guys, Avnish and Adam. How did this happen for you in your neuromuscular clinics?
Yeah, so I'm actually still kind of transitioning from my pediatric care to my adult care. So I just graduated college a couple of years ago, and I was all over the place. You know, I went to college pretty far away from where I live. So I just stayed with my pediatric care, and then graduated college, pandemic hit. So still kind of setting up the first appointments with my adult physician. I was given referrals from my pediatric care. So I went to Seattle Children's Hospital as a kid, and then I'm going to transition to the University of Washington Medical Center, which is closely affiliated. So a lot of the pediatric people know the adult people. So uh, I'm just waiting for the appointments to get free, basically.
How does that happen? One day, do you just show up in the adult clinic?
Yeah, I mean, I just have to give them. They emailed me a couple weeks ago saying they have appointments available. So just call them, schedule an appointment, kind of introduce myself. It just happened. It'll happen later in the summer. So yeah. I think the hardest part was starting that transition because I'd become very comfortable with my pediatric doctors and I'd formed some sort of relationship. But knowing that finding someone who knew them, I think it was helpful. Yeah.
And what did you do while you were at college? Did you just come back to Seattle Children's when you needed something?
Yeah. So I came back for like spring break, summer break, and then I had in college. I mean, there wasn't a great hospital where I went to school, so I just I didn't. I was pretty lucky. I didn't get sick or anything when I was there.
Adam, what are your experiences?
Well, so many of my experiences were similar in terms of, I think one of the most important things is finding the right specialist. And that's something that's very much easier said than done. But I'm very lucky to have an awesome mom who kind of makes those connections for me. And as well, our location is kind of important and really helpful because we live in New Jersey, so we're very close to New York City, and where a lot of people tend to, doctors for various specialists are. And I think the other thing is that you mentioned how does it work at college, and I think that's a really important point because you could totally have a system that works really well when at home, and then you could move away and then things are thrown up in the air depending on distance or depending on the level of support you have. And in my personal situation, I chose a college that was very close to my home, just as kind of a safety net where I knew that I could always rely on the same like care providers and as well as my family in order to kind of have that backup. And actually what I would do is anytime I would have a break, meaning like summer break, for example, after finals, we have just been lining up appointments because that's really the time that you can get them all done. So I find that you really, even when, I think what part of your question was like, how are things when they're going well? And I think even things going very well still requires a huge amount of coordination and determination because you have to stay on things constantly, on top of things. And of course, insurance and all of that are common issues I'm sure we have. But yeah, that's kind of been the main thing for me, and it's been going well. I think one of the takeaways for me is that when you have a lot of health situations going on at once, that if things are going okay, you can get to a spot that's stable, but it has to be very intricately set up, if that makes sense. So you find that if one thing goes, then it becomes a whole issue. And so it's kind of a very, very well set up but fragile system, I would describe it as. But it's been going well so far for me, so I'm happy about that.
At what point did you transition from pediatric care?
Well, so I actually have my primary care provider is still my same pediatrician that I've had all my life because I'm 20 right now and I haven't yet hit that cutoff. But I have started to see, here's an example where I really had to transition actually, is I have essentially what's equivalent to a diagnosis of osteoporosis, which is something that is extraordinarily rare, first of all, in males, and secondly, in very young people. And so this is actually something that I had to see a specialist in New York for. And so because there's nobody that's really around treating that for, it's almost exclusively geriatric, in fact. So that's an example where we had to find a specialist that was completely outside of the scope of what like the support network we previously had. But then that's been going great once we found the right person who is an expert with it, and we're keeping monitoring it, and that's as much as we can do.
Kelly, anything to add to what the guys described?
Yeah, I would say my transition actually didn't go very well, kind of the opposite. So when I transitioned from pediatric care to more adult care, the specialists and places they referred me to hadn't really heard of my condition before and didn't really know a lot about me. So I actually transitioned and then I went back to my more child pediatric doctors because I felt more comfortable, even though I was aged out. Technically, they made exceptions and were still able to see me and treat me. So I would just say like going where you're comfortable and like don't let them pressure you into switching if that's not a good fit for you. And it wasn't for me. So I actually did went back and yeah, I've been still receiving good care and just chose that route instead of going where they, kind of wanted me to go.
Why did you transition in the first place?
Because of my age, they said they try to kind of usher you and you see my more people that deal with more adult symptoms and things. So they tried to, kind of steer me that way, but I just did not feel comfortable and didn't feel like that was fitting for me. So I just went back and they were able to still see me and make an exception for that matters.
Well, that's great. Is it at a children's hospital or is it more?
Yes.
It is. Okay.
Mm-hmm.
And so they made an exception.
Yeah. So whenever I call scheduling and stuff, they're like, oh, with my birth date, they're like, why are you still here? You kind of have to explain and advocate for yourself. Hey, I'm a specialized and this is what I need to suit my needs.
Is there anything you want to share with us about what the breaking point was for you in the transition where you said, all right, I'm not gonna mess around with this anymore. I'm gonna go back to the people who know me.
Yeah, I would say probably when he hadn't even heard of my diagnosis, the neurologist, that was just really scary to me. And he said, I'll have to read up on it and get back to you and educate myself on it, when I probably in turn knew more about it than they did. So yeah, I just didn't like to play around. I want to go with people that know what they're doing and know more about me and are able to treat and help my needs.
Okay. And can any of you would like to comment on how care is different in an adult system than a pediatric system?
I think so. There's some things I've transitioned to adults with already, some I haven't. So the main difference is you have to advocate for yourself a lot more, and there's a lot less like a hand-holding kind of. There's a less prodding questions. So I think when I was a kid, I was always asked like, does it hurt here? Does it hurt here? Does it hurt here? But now I have to kind of say, hey, this is how I'm feeling. This is the issue. What do I do? So I think that's one big thing. Another big thing to me has been, so when I was a kid, I used to not schedule all my appointments, but now I do. And that's something new as well. And dealing with insurance and all that. It's kind of a pain. I'd also like to add that I've been pretty lucky where there's someone with my same condition who lives in the same area, who's like a couple of years older than me. So I can kind of just follow in her footsteps. I don't have to worry too much about finding someone who doesn't know about my condition. I can just kind of go with what she's gone with, and they have some context already.
Now, Avery, you're the youngest of the group. So tell me a little bit about what this looks like now for you. Has anyone talked to you yet about how you may need to transition care providers when you get older? Has this topic been introduced to you in healthcare?
Not really, but I have seen some resource guides that I've looked at just for getting ready for it, because before I know it, it will probably be here. So I have looked at those, but besides that, I haven't really gotten introduced to it that much. But I feel like as I've grown up, I have kind of transitioned in just these doctors, just because I'm paying more attention to my appointments. I ask my own questions. I really do advocate for myself. And I think my parents have also backed away a little bit more because they know I can do it and they want to let me do it, which is very helpful for me. I also personally ask my doctors questions that I have, and I also answer the questions they have before my parents do. I'm also pretty involved with my care. Like, I like to know when a doctor calls, what they said, and just so if anyone asks me anything, I'm able to answer it and not be like, oh, like my parents handle that. It just really helps. And so I feel like I've already kind of transitioned, and I hope that when the time comes, it will be fairly easy.
Great. I think you bring up some great points about this being a process starting when you're younger, and starting to speak up for yourself and pay more attention at appointments and things like that. When did that start for the rest of you?
Yeah, I would say definitely like college years and after, just kind of finding your voice and saying, hey, I can make the appointments now and I can say more how I feel. And I was more shy, and I guess it can be intimidating too. And in a room full of doctors, it's kind of overwhelming. So just like learning to be your own voice and say what you need or what you think.
So did you, before you went to college, did you just mostly let your parents or your caregivers do that kind of speaking for you, or what did that look like?
It was a little bit of a combination. I would say my parents definitely were very involved in that, and I would kind of, put my 2 cents in here and there. But then after, kind of college, getting your independence and trying to do things more on your own, I think really kickstarted, doing things yourself more, using your voice and advocating for yourself. It's more what I started handling and managing that more.
Adam, how about for you?
So that's an interesting question for me because I'm kind of in the midst of that transition phase right now at this very moment. It really is still the case that, especially with a lot of insurance issues, where that's just kind of over my head in terms of the level of responsibility and time commitment that it sometimes requires, that my mom still helps me with a major amount of that. But I still do make sure to advocate for myself for my appointments. We'll have discussions about which appointments I should go to, which doctors I should see. And so I feel like I'm becoming a very active part of that conversation, but also I'm still in that middle ground where there is a lot of tricky things to navigate that I just don't have the experience to deal with, or that is, quite frankly, extremely stressful. And so I'm really glad to have my parents as supports for me in that process. And I think it's really important to, at least for me, it's not like going straight from 0 to 100 in terms of like, hey, you flip a switch and then now you're doing everything. I think it very much is a step-by-step process of, getting to know your needs, getting to know what it is you need to say at the appointment, then figuring out, okay, when do I want to do these, in what order, what's important. And it's just something that comes over time, I think.
Yeah, great insight there. Thank you. Is there anything that's like, what's the trickiest part? I mean, what's the one thing that you just immediately kick to mom?
Insurance, for sure.
Okay.
Yeah.
Insurance,
especially, yeah, because it will happen that we will get like a letter in the mail that will say, hey, that thing that you really need, that your life kind of depends on? We don't think so. And we're like, okay, hold on, excuse me. And then it takes 20 phone calls and 10 hours and, whatever. And that's certainly like one of those kind of, I don't know if I call it like an emergency situation, but it really is like very much, I'm extremely glad to have help with it.
Avnish, how about you?
Yeah, I'd say insurance for sure. I'm still on my parents' insurance. They don't kick me off that till I'm 26, I think. Sticking with that. And then I think we had a change in our insurance a couple years ago. I wasn't able to get all the supplies like for my BiPAP as often as I was before. And that was kind of very stressful. There was like 2-year period where I wasn't able to get supplies. Finally, I took charge of that and I was able to change the supplier. So I was able to get supplies for that. But I think billing stuff is kind of very stressful at first, and then you kind of figure it out as you get older. I kind of transitioned slowly. So like the first thing I transitioned was like my physical therapist. So I went from a pediatric physical therapist to adult one. That was around when I was like 13. And then slowly and slowly, I changed like one doctor a year. So that kind of made it more smooth. Like dealing with a lot of uncertainty at once can be a little bit stressful. So I definitely recommend doing it slowly.
When did you start, Avnish? When did you start kind of speaking up more at your doctor appointments and playing a more central role in your care from that respect?
I'd say when I was 14, I had a spinal fusion, and that kind of took some proactive steps on my behalf too. So I was kind of forced into taking more responsibility. So I had to do like certain exercises, like for breathing and stuff, take care of like how I sleep, all that. And that was a big step for me. And it wasn't really like I chose to do that. I was coming kind of something forced upon me. Just so I could take care of my health, I had to be more proactive. And I was the only one who could really take care of my body. So
Okay, great. How have either your parents or your physicians facilitated the process of you being more in charge?
So basically, like my parents just started letting me answer more questions, and they knew that I could do it. But then also, what was also really helpful was that the doctors themselves could see that I was getting older and that I could also speak up for myself more. So they were letting me get involved more and just directly coming to me with questions. If there was something that, say, I missed that was really important, they would, of course, step in. But my parents and my physicians have been really good with letting me take more charge.
yeah, I'd say the same thing. I think my physicians really directed questions towards me more and more. And that's a big thing. And then also, I wasn't diagnosed until I was about 10, I think. Just after I had the diagnosis, that also changed. Because I think when my parents weren't sure what was going on, it was very stressful on them and didn't have many answers. So once like I could get like documents printed out and I could read them, it was a lot easier as well. So that actually something else I do is if there's any sort of blood work or something that's run, I make sure I get a printed copy of it, and then I have like a file cabinet with all that stuff in it. So if I ever have any questions, I can always refer to that.
Do you do your own research on those kind of things?
I don't really do too much research. I just, like my
You just
doctors,
have it.
I just have it just in case, like I get like a oxygen level test. I have all those saved for like past 10 years.
Well, for myself, I'm kind of in a unique situation because actually my dad is a doctor and also my mom is an OT and does a lot. So they were very good about knowing how to manage and navigate that kind of healthcare system and also how to sort of train me, I guess, if that makes sense, in how it works. So almost actually, now that I think about it, after every appointment or whatever, for as long as I can remember, they would be talking to me about, okay, this is what we're doing, this is why we're doing this is how this works. My I can remember my dad taking out the papers and showing me, okay, this is a form for explanation of benefits, or here's what your insurance is covering, here's how the bill looks. And so even just little details like that are really helpful because of course taking the initiative on it is important, and I've done my best to do so as well. But also it really is just so valuable to have somebody who just knows how it works to sit down and explain it, because sometimes it's something that can seem so mystifying when you're not as involved with it. And so it really is almost like learning. I would even equate it to like learning a new language or something, where it's almost this kind of whole realm of stuff, and the terminology and the policies and the who do you talk to for what is something that is, needs to be learned, but kind of step by step. The surgeries are a major milestone point, I would say. And that's probably true for many people, I would imagine, because that really is the point where your health is your number one thing going on. You have to stay on top of it. There's all of the results are directly on you, meaning, it's up to you to do the preparation for it in order to find what needs to be done, or okay, who do you trust in order to do the surgery, where are you going to the hospital, where are you, all of those little details. Those are things that are like very much thrown at you in the forefront.
It just kind of ups the stakes of what's involved, doesn't it? And if you ever had to be an advocate for yourself, that's a very important time to do that.
I would say just kind of learning and shadowing, like what my parents would do and how those phone calls went. And, when you get the mail, what does this mean? And just kind of learning what they would do that helped me for so long. And then kind of just taking over as you get more independence in your later teen years, and then going off to college and stuff, and just learning that, you're the one that's going to be doing all of that now, and just stepping up and taking that on.
I mean, I'm sure you all have experienced a time when you needed to be a real advocate for yourself in the healthcare system. And I'm wondering if you could just share a story with us about maybe needing to really find your voice when it came to your healthcare.
One, I would just say some my neurologists out the years would always order significant amounts of blood work and stuff, and they were still figuring out my diagnosis. And then just like not understanding the results or what those meant. So I kind of finally, began to speak up and saying, I'm doing all these things, all this testing, what does this mean? Can you help me get those answers we're looking for? So just kind of making sure that they explain it to you in more terms that instead of scientifically what all the things mean. So just like trying to get answers that make sense, that you understand, and having them explain it better so that you can understand what's going on. What does this mean?
Yeah, like Adam said, it's a whole new language.
It really is. Yeah.
Because I'll just take an opportunity to give a shout out to SciFam, because I really do feel like, looking back, what was like a time or milestone for me where I really started taking that active role in learning as much as I could and speaking up about these types of things, really was in the 2019 SciFam conference.
Education is an important form of advocacy, self-advocacy.
Oh, yeah, 100%.
If you don't understand your disease, it's really hard to articulate, what your need is, and to be an active participant in your care.
Good example of this was when I was in college. I actually sprained my ankle pretty badly, and I had to go to the emergency room just to make sure I didn't break anything. And doctors there had no idea what step in one was. Like I went to college in a pretty rural place, so didn't have the resources of a big city. Just explaining to them what it was, why some of my body looked a little bit different than what they expected, and making sure they were properly able to just focus on my ankle, and also make sure they gave me medication I wouldn't have a adverse reaction to. So I know I have some medications that don't work with me. So just making sure I could do that. I mean, my parents weren't there. It was just me and my friend who drove me. And that gave me confidence to know, like, hey, even if I'm in the middle of nowhere, I know I can advocate for myself. Yeah.
It feels good to have that win under your belt, navigating a tough situation. Were they responsive to you and to your feedback and everything that you said?
Kind of, not super. I think the doctor who came in was, but the nurses, not as much. I mean, it was an emergency room. They were very busy. When I'm here in Seattle, and I just go to somewhere I know where I've been before, I mean, when I was in college, just wasn't the case.
Let me ask an open question to the rest of you. As adults or teens, do you feel like you have your healthcare sorted out in an emergency situation, that you have a plan, that you know where to go and what to do?
I think that's actually a really good question, and I think all the more important over the last year, especially. I do have emergency plans. I even have like things that I carry on my phone in order to have medical alerts, and I have a little note that's like a respiratory information card for my disease, and we have even like a binder and like bags to bring to the hospital of things I may need. So it's very important to be prepared for those things. But especially as soon as the pandemic hit, then we really had to reevaluate a lot of those plans and think, okay, this isn't just something where you can, something's happening and you walk into the hospital, but you still have parents or family to support you, and people can bring things there that you may need in order to keep you supplied with whatever it is. It can be like, if you're in a hospital these days, they're so incredibly overwhelmed. You could be out in the hallway or anything, who knows? It's a very dangerous situation that we really had to think a lot about in order to make sure we're prepared. So I almost think there's levels of, obviously it's good to be prepared in any amount that you can be, but there's also levels of prepared where you have prepared for the expected, meaning you think you're prepared for whatever emergency may arise, but almost you have to think steps beyond that, where you have to prepare for things you could almost never expect, which sounds impossible. So I'm sorry to give that advice, but that's kind of how it is. So I feel like that's the reality of the situation, but we do our best to stay on top of it. And of course, there's always room to improve or more to think about.
Thanks for that. And thanks for bringing in the COVID aspect too. It's really just changed everything.
Yeah, I did something really similar to Adam. When I was in college, I had these sheets printed out with what to do in the case of emergency, and it had like step-by-step instructions. I had them nice and laminated, and then I gave them to like my RA, roommate, stuff like that. I'm not as worried about that at home because I have like my parents live here, and I have doctors in the area as well. But maybe when you go like somewhere different.
I'd say probably not as prepared as I should be, but I'm always trying to take steps to do that. No, I would say I just have probably a good amount of like contacts that I feel comfortable with in an emergency situation that I could reach out and they could provide answers and things that I may need.
Yeah, it's certainly important to make plans with not just your family, but also with your healthcare team. If you end up in emergency room, not in your hometown, you could be on the other side of town and end up in a completely different situation that you don't expect. But yeah, that's certainly important. Do you feel like right now, do any of you feel like you have healthcare needs that are not being met?
Yeah, I feel like, I think I always discover maybe new things I maybe need. Like, I think right now I'm looking for a massage therapist because I just get these knots in my back or something. But something I always have to do careful that I work with someone who has maybe experience with people with like some sort of muscular condition or something. So I think maybe it takes a little bit longer for me to find a doctor, but I'm just very thorough.
Ever since the pandemic, I wasn't able to get PT. I was able to get virtual PT, but not with my actual PT that I was working with before the pandemic because the facility I was going to had not let outpatient pediatrics back in yet. So I wasn't getting any PT. We really wanted a PT that was familiar with neuromuscular diseases. And we wanted someone locally, and I know like what I like and who I like, and not getting PT was just a major setback for me during the pandemic. I think half of it was also us being comfortable with going to a facility and letting someone else treat me. And we tried virtual PT. It wasn't with my actual PT that I was seeing before the pandemic, but my parents also admit that they know that they're not also PTs. We thought it was just really key to find one as soon as possible because it really affected me. And thankfully, a couple weeks ago, we just found one. So that's resolved, but it took definitely a long time.
Yeah, guys, these are great examples. It is not uncommon to have periods of time where you're looking for a specialist for, you know, especially like an adult pulmonologist that understands neuromuscular disease and pulmonary weakness and neuromuscular disease, because it's a little different than what other adult pulmonologists deal with. You know, not uncommon to be on the hunt for an adult cardiologist that understands neuromuscular diseases, physical therapists, things like this. Yeah, these are great examples. Does anyone want to comment, you know, how have your needs changed as you've either approached your teens or in adulthood? Do you want to say anything about, you know, how your healthcare needs have changed?
I would just say learning about more adaptive equipment that's out there that can kind of help me from day to day stay as independent as I can be and help me with my daily needs. So I would just say like learning what's out there, keeping up on like the latest technology, and then also, you know, having those conversations with your doctor saying like, hey, I saw this new device and I get a prescription, and just starting that whole process of trying to get new medical equipment approved. So I know that's been really helpful for me as far as trying to, you know, see what's out there and use what I can to help continue to maintain longevity and independence.
I would say the number one thing that has changed, rather than the things I need, which stay reasonably consistent for myself, I think, are who is doing the providing for that. And what I mean by that is that there, and this is true in just general life as well, there are plenty of things that your parents or family would do for you or help you with as a child or as a kid growing up and living at home. And then that dynamic entirely changes once you either move away or decide to draw those lines to become more independent and start doing your own things. And so I think that while there are still some things that I require outside help with, of course, but there are also plenty of things that I've taken up on my own. And so it really is about finding what that balance is for you. So that's not something I can specifically say, well, for you, you're going to want to do this at this age and then this at this age. It's obviously, of course, it's different for everyone. But the general idea to me is that you definitely want to look at, okay, what's something that somebody else is doing that I could at least do part of or learn how to do if I needed to. And then it becomes, okay, if somebody's not home, I could take care of that. And then it becomes, well, somebody is home, but they're busy, I'll take care of it. And then it becomes, okay, well, regardless, that's something I can do all the time. And so there's kind of a spectrum of what your abilities are, of course, and that's different for everybody. But I think just keeping that idea in your mind and also noting that if you move away, it might not be the same people who are able to help you with things, and you might have to find agencies or, you know, for nursing or care or that kind of support.
I love how you illustrate the process of it.
I had a spinal fusion, and that has definitely changed my body. I'm less leaning over. It just really changed my body, or there's just more things we need to look out for, especially with going to, like, say, if I ever end up in the emergency room, we definitely have to make sure we tell them about some stuff. So I'm gonna say that, like, my needs have definitely changed from that, and I've also experienced a little bit more pain in certain areas of my body because of it, and I'm not able to move in some directions as I used to, I guess. So, like Kelly was saying, I'm really trying to find technology and stuff that can really make me more independent or in my house.
I mean, recently something that's changed is I've become sitting down a lot more because I work from home now. So I think being more conscious about my everyday routine, like making sure I get a little movement, making sure I maybe do some stretching or something. So I think as I gotten older, maybe that's become more important. Mobility, stuff like that.
Yeah, I mean, I think it is. I think it's all related to your healthcare needs and, you know, staying functional and independent and whatnot as long as you can. Now, as we start to wrap up our webinar, you all are either in the middle of this or on the other side of it. I mean, you're the experts here, not just on your own bodies, but you're great mentors for other people in the CMD community who are either going to go through this or are going through this now. So what kind of guidance would you provide to parents of younger kids about the transition to adult healthcare and how to prepare kids for adulthood?
I think you have to listen to the person with the condition. They have to be, end all be all. I think there are times where you can get frustrated, but you just have to, if the patient tells you, hey, this is how I'm feeling, I think you just have to take their word for it and then work with them and let them make their own decisions. Self-advocacy is very important. I think also listening to people is very important.
I think one of the number one things I would say is you really have to teach someone to be their own expert, because of course finding specialists is important and being a knowledgeable parent is really important. But I think the number one thing is that for someone growing up, of course, they're not going to start off with all of that knowledge base, but you really have to get them to a point where they can internalize everything about themselves because, like it's been said time and time again, just in this talk alone, that really the individual is where it's the starting point, right? You have to speak for yourself. You have to know yourself better than anyone else. And so part of parenting is teaching somebody how to do that. And I think one of the other tips, as far as a specific example of that, is I think although many things for it can be extremely complicated, dealing with insurance, making appointments, finding specialists, engage your child with what's going on in a way that's not overwhelming, that's not, if they're not able to do it, you can still continue to provide that support, but have them be present to it, meaning, show them how it works. Say, hey, I'm going to be calling these doctors. This is how it's going to work. Okay, we're going to make these appointments, or okay, we're gonna log into a health portal in order to get the test results. That's something really common, and just showing them how to do that, and then eventually, that way they'll be able to start doing it for themselves.
Don't be afraid to seek out second or third opinions because one doctor may not have all the answers. So don't get frustrated when maybe someone's not understanding you or are not getting you the results that you may need. So I think it's important to know that there may be others out there that could help you better get your needs met if that's not happening right now. And yeah, I would just say just self-advocating and listening to the person with the condition. What do they feel comfortable with? What do they ultimately want? And, not pressuring or not trying to sway either way, or just listening and being, there for them throughout their journey is really important.
Like, you may think that you know them really well, but the affected individual knows their body the best. So definitely listen to them, really standing up for you and your family. But when you are transitioning, if you visit a doctor and you just don't like them, don't be scared to try and find another one. You may or definitely won't find someone you like just on the first try. So definitely be patient and you will definitely find the right one for you and your family.
What advice would you have for young people your age going through just transitions in healthcare?
Definitely self-advocacy. I think definitely more for the affected individual. I think don't be scared to reach out to people that maybe have already gone through it or are going through it, because that person probably reached out to other people also. So if you have a question, they might know a little bit more than your parents.
I would just say standing up for yourself, finding your voice. And I know sometimes there's uncomfortable conversations or things maybe with doctors or even parents or whoever that you may not want to have. And it's okay to say no and know that, it's your body and your needs. I had an original neurologist wanted me to do like all these extra operations and things. that were unnecessary, and just knowing that it's okay to say no and get different advices and opinions, even though it may be uncomfortable to have those. It's definitely okay. You just got to learn to do what you need and what's best for you.
Don't feel like all of the weight in the world has to be on you right this exact moment. That growing up is kind of, it's not like you wake up one day and you're 30 and you have to pay all your bills. You have time to learn these things. And so it's kind of, like I said, it's a process of transitioning. That's why we're having this conversation. And so I think make sure to just think, well, what's one thing I can do right now? What's something that, change one thing at a time or learn something new, and just you keep doing that over the years, then you'll grow to be a person who can take care of it for yourself. So I think, it's not something that's a race. It's a very overwhelming topic that can be so much to take in all at once. So just keep in mind that, this is something that hopefully other people are here to support you for throughout, that your care providers are here to support you for, your clinicians, and that you can also be your number one support for yourself, and that's a process.
I think you have to remember that all these people are here to help you, and what you should do is help them help you. Your doctors are here to help you. Your parents are here to help you. Caregivers are here to help you. I mean, the people at Cure CMD are here to help you. So just, help people help you.
I just want to thank our panelists, but I also would like to remind people about the Got Transition website. That Cure CMD is a fantastic resource. Should you have questions about your healthcare, about transitioning to adulthood, about trying to find providers, and also connecting with other young people, or for the parents watching, connecting with other parents who are in this situation or have been where you're headed. So I think today we really highlighted the fact that the transition, any type of transition, is meant to be a process and not an event. And that you can see we have young people on the panel from 13 through early 30s, and in various stages of transition, and that this is a bit more of just a lifetime process of having a successful adulthood, and being empowered to really direct your care and to live the lives that you want to live. And so I want to thank our panelists again, Avnish, Adam, Kelly, Avery. You guys have been fantastic today. If any of you out there that are watching have questions, you can contact Rachel at Cure CMD. And we just want to thank you for joining us today.
Thank you for having me.
Yeah, thanks so much. This has been great.
Thanks.